Hello, my name is Dr. Deepak Ravindran and I am a pain management consultant, and I've been working in the NHS and privately in the United Kingdom for over 10 years. Often looking after chronic pain patients can be a challenge, and more importantly it's a rewarding experience for consultants like myself. And in the last 10 to 15 years there have been some wonderful pieces of scientific research and understanding that has made it possible for us to manage chronic pain and to actually treat chronic pain in a much more holistic and integrated fashion. One of the wonderful pieces of research that I have come across and has influenced my practice in how I look after my patients and how I tend to view chronic pain management itself has been the role and influence of adversity in childhood. Now you may be wondering, what does that have to do with chronic pain? And to be honest, even I had the same queries when I first came across the scientific literature. This is not a new thing. This has been a study that was first published in the late 90s in the United States of America, and it was a study that was done in San Diego. It was called the ACE study, the Adverse Childhood Experiences study, by Vincent Felletti and another gentleman called Robert Ander. And the results of this study show that when our nervous systems, when our developing nervous systems are exposed to adversity when we are children, so this adversity could be in the form of abuse, emotional, physical or sexual abuse. It could be neglect, it could be emotional or physical neglect, and any form of what we call family dysfunction, wherein the dynamics of being within a family are disrupted. For example, you may have a parent who is been using drugs, you may have a parent who has unfortunately had to go to prison or is struggling with a significant mental illness, and you may have been experiencing your parents undergoing a divorce. Any of these circumstances can cause trauma, can cause a significant amount of stress on a developing nervous system. The first 3 years are critical and the first 7 years are vital, but we've now found that actually anything before the age of 18, i.e. even during adolescence, teenage years, bullying or workplace related distress can cause a trauma to the nervous system. And if somebody is vulnerable, if they are exposed to such trauma and they don't have a support of some kind of resilient father, mother or some kind of adult figure at that time, then that trauma lives on in the nervous system. It affects the nervous system, it can affect the immune system, and it can affect the endocrine system. It will affect all the other systems of the body. And the outcome happens when you're in your 20s or 30s. And that ACE study has actually shown that patients or people who have experienced that adversity in childhood can end up adopting risky health behaviors, end up getting more risk of addiction or misuse or abuse of health. They end up having more chronic diseases like asthma, like obesity, like type 2 diabetes. They end up having more mental health disorders like schizophrenia, bipolar or ADHD. And at the end of the day, what we've realized actually is that they use healthcare much more than a normal population would. Their healthcare utilization is significant. Chronic pain, especially headaches, tummy problems, IBS, respiratory problems, neurological pain, nerve pain, all these painful conditions are exponentially high in people who have had adversity in childhood, and sometimes the outcome is so bad that the studies have shown that they may on average die 20 years, I'll repeat that, 20 years earlier than a person who has not been exposed to that adversity. And the reality is that although that study was done in the US in the 1990s, it has been replicated and the results have shown to be uniform when it has been repeated in other parts of the world. We've had that same report in Wales, in Scotland, and even within England, and the results are similar. 20 to 25% of our population has experienced 4 or more adverse events during their childhood, thus putting them at a high risk of all the chronic pain conditions and the other health conditions that I've talked about. So if you are in a pain clinic setup, we as pain consultants have to be more aware of how we manage these patients. We have to be more sympathetic and compassionate and understand that adversity in childhood can have a significant influence in how they respond to our treatments, how they respond to any surgeries, and how their final outcome is going to be. And that has a role to play, because you need to get it right first time. When patients present to their GP, to their healthcare professional, to their surgeons, to their pain doctors, we need to get it right first time. We need to do the right thing for them. We need to ensure that such trauma is recognized. And so I'm part of a movement here locally wherein we want to make everyone trauma informed. We want everyone to be ACE aware. Scotland has become ACE aware in September 2018. Wales has done the same. There are a lot of resources that are available, and it's important that you, as a member of the public, understand this. And if you are a healthcare professional watching this, read more about it, become more aware, look at your patients and see how you can help them better. Because if you don't take these factors into account, then it is unlikely that any of our existing treatments will last for long. And that will mean we are wasting and spending unnecessary healthcare resources when we should be giving a more holistic, integrative, compassionate treatment to these patients. In fact, it makes us better physicians, better doctors, and better community in the population. Thank you.